Welcome back to Metropol Television. Thank you very much for being a part and parcel of our broadcast this morning. My name is Simba Elijah Charles Kiage. All right, let's cross over to exactly what it is that we have for you this morning. And according to the International Agency for Prevention of Blindness, Sub-Saharan Africa has long been characterized by a lack of eye health and vision personnel, which has contributed to the high prevalence of avoidable vision impairment and blindness. In the report, they state that with aging populations more disposed to sight loss and with risks such as diabetes increasing, levels of avoidable blindness in the region are likely to rise, calling for governments in Africa to adopt strategic approaches to addressing their eye health crisis. Now, the most recent estimate by the organization shows that 21.5 million people in Africa are visually impaired across 48 countries, with the estimate indicating that 550 million people need glasses as of 2010, with only 1% of the population in need with proper access to the glasses, which translates to just 1.3 million people. Now, top of the reasons as to why the statistic exists is the difficulty in accessing of ophthalmologists and other eye specialists in the continent, compounded with a high cost of corrected frame lenses, as well as insurance companies still figuring out the space, which has caused a lack of market framework across many nations in Africa, Kenya included. Now, this morning, to talk about the state of eye health in Africa and Kenya and what it needs to be done, therefore, to unlock its potential, we're joined by Rosalina Kilonzo. All right, let me just go and get you the proper titles this morning on exactly what conversation we're having this morning. All right, yes, we are joined by Rosalina Kilonzo, Expansion Manager, East Africa, all right, for English-speaking countries, La Paire Glasses. We're also joined by Oliver Manko Wambile, who is the Public Relations and Communication Officer at East Africa, La Paire Glasses. Rosalina, good morning.
Good morning to you, Simba. Thank you for having me.
Happy to have you around as well. Let me also cross over to Oliver. Good morning, sir.
Good morning.
Happy to have you around. Fantastic. Let me start with you, Rosalina. Can you comment on the state of eye health in the country?
Yes, of course. So in Kenya at the moment, we have about one ophthalmologist for about every 250,000 people. And the same thing applies for optometrists.
Yes.
Yeah, it's crazy. I know.
Is it not crazy? Rosalina, I'm sorry to cut you short. Can you repeat that number? How many as well? One against which number?
One against 250,000.
Oof. All right, let's continue.
Yes, it's crazy. So the biggest problem at the moment is accessibility and the cost to eye care services and eyeglasses. So the Ministry of Health estimates that about 15.5% of Kenyans are in need of quality eye care services. And this is ranging, from surgeries, eyeglasses, and even the most basic of eye treatments. Yes. So the good thing is that the government of Kenya has made eye health one of its priorities with the National Eye Health Strategic Plan of 2020-2025, which basically is aimed to serve as a guide for understanding eye health priority needs, how to deliver them, basically embracing the eye health system, offering a more people-centered eye care approach, and finally, recognizing eye care as an integral part of the universal health coverage.
Pretty much, Oliver. Let me also get your sentiment. And I'll ask you like this. Well, we're talking about Africa because I know you are in a different Africa economies as well. Do we have the same problems in Sub-Saharan Africa when it comes to eye care?
Well, for the whole Africa, I consider the world Health Organization, the WHO, classes Kenya as number 3 in Africa, after South Africa and Tunisia. Then, number 4 comes Algeria. Number 5 is Nigeria. Number 6 is Egypt. Number 7 is Morocco. Number 8 is Rwanda. And number 9 is Tanzania. And number 10 is Zambia. So you will see that Kenya occupies the 3rd position. And with the numbers that Rosalie just gave, it really means that Kenya counts more eye health professionals, let me say optometrists, ophthalmologists, surgeons, than any other country in the region. That East Africa. Yeah, like Uganda. Right now, I'm in Uganda.
Yes.
And for instance, in Uganda, you see eye care services are largely like concentrated in the capital only. You know, like if I can say, the first optometrist graduated from Makerere University in 2019 only. So you can see that in Kenya, access to eye care services and eye in general is somewhat easier than in Uganda, because there are some, specialists, but the cost remains expensive, and that is something that we can be looking at urgently.
All right. Now, Rosalind, when we look at these numbers that we have this morning, the bigger numbers. You also mentioned bigger numbers, that it's 1 against 250,000. But on the back of that, even as in 2010, we're talking about 21.5 million people who are or could be visually impaired. So when you look at this stat, and I know you've been in this business now as La Pair Glasses, what are the major contributors of this visual impairness that we do have existing in Kenya and Africa at large?
Yes, thank you for that question. So the biggest, contributor, I think I can say the most common cause of eye problems in Africa is mostly refractive errors.
Yes.
When I talk about refractive errors, I'm talking about short-sightedness, which is also known as myopia, in the medical jargon. I'm talking about long-sightedness. I'm talking about astigmatism. These are issues that basically impair someone's vision to see well. And that's like the most common cause of, eye problems. So other problems include, for instance, glaucoma,
yes,
which basically, it affects the optic nerve, because of increased pressure in the eye, and it can cause blindness. It's actually the most common cause of blindness for people over the age of 60. And another problem that can cause eye problems is macular degeneration, as well as cataracts, which, pardon my voice,